A new cervical cancer treatment regimen could save lives by 40%. Research just published within the last week focuses on adding rounds of chemotherapy ahead of the standard treatment for patients. It found higher success rates. Cleveland Clinic oncologist Dr. Roberto Vargas is with us now to weigh in on the findings, what he thinks when he read through all of this. Thank you so much for taking the time, Doctor.
Thank you for having me, Lindsay. We're definitely excited about this new study that was recently published.
And let me ask you, the study published, I want to pull up some of the stats because people need to see this. It was published in the medical journal The Lancet involving 500 patients from 32 countries. Researchers found that 80% of the patients who got the 6 weeks of chemo lived 5 years longer, and 72% of patients did not have the cancer return or spread. So why do you believe this approach is so effective?
Well, the exact mechanism as to why it gave us such amazing results is something that's currently undergoing further research. But the study itself, getting us these outcomes is pivotal because we've been really using the same standard therapy with chemo and radiation over the last 20 plus years. And we've tried different variations of when to give chemotherapy, when not to give chemotherapy. And all those other studies had failed to show any improvement. So to have patients now have a 40% lower risk of having their cancer return or dying from their cancer within their five years is very, very significant.
Would you say the 6-week course of the chemo treatment will now be recommended based on the findings, or is it going to take some time and more research?
It's going to take some time for it to become what we would consider standard, but it's already being considered and implemented in specific patient populations that we would consider higher risk than others.
What causes cervical cancer?
So the majority of cervical cancer cases are due to the HPV virus.
And how often should women get screened for it?
So the screening for cervical cancer, the recommendations vary based on age group, and younger patients, they'll be getting pap smears with HPV testing more frequently than older patients, but it ranges between every 3 to 5 years as long as we're using HPV testing with the pap smear.
Now, how effective is the HPV vaccine, and when do you recommend as a doctor young women get this?
Yeah, so there was a landmark publication in the New England Journal many years ago now that showed that the vaccine, particularly when given in the teenage years, can be above 90% effective. I believe the number was around 98% effective in preventing cervical cancer. So the earlier, the better.
Now, when you look at the research done here, you said this is a significant step forward. How important is this type of research, and is there other studies underway right now on cervical cancer that could also lead to more advancements in the care?
Absolutely. There are ongoing studies, again, challenging this standard treatment that we've had over 20 years now by adding things like immunotherapy and adding new chemotherapy agents to try to improve how well patients do when they're receiving chemoradiation, maybe even reduce how much radiation they need in the hopes of improving outcomes and also reducing side effects.
All right, definitely a very big study that came out. Doctor, thank you so much for taking the time to join us here on 21 News at 5.
Thank you so much, Lindsay.